there's three things that I would address. The first thing is the chronicity of asthma. I think people think differently for asthma comparison to, for instance, diabetes or high blood pressure. They understand that that is a chronic disease and they have to continue using. For some reason amongst doctors and the patients suffering from asthma, they think that it will disappear. I'm going to outgrow it. Even if I'm an adult, it will disappear. I'm going to outgrow it. So once the symptoms are better, I can actually stop my medication. And this is the stop and change all the time. And then we lose control. Asthma is chronic inflammation, and chronic inflammation that is not chronically treated will cause some complications later in life and actually damage the total lung function over time. So that's one of the real big misconceptions. The second thing is that it's easy to use an asthma inhaler, and doctors don't always take the time to explain how to use an asthma inhaler, and there are different ones that can be used. The pharmacist think that the doctor has actually explained and showed the patient. The doctor think the pharmacist is going to do that, and the patients think that I would really look stupid if I ask, how do I actually use this? So it is not easy. So please, for the healthcare professionals looking at this interview, please explain and show. And if it's patients that are listening, please ask. It is nothing wrong. It's difficult. And it is so important. To drink a tablet or give an injection is easy. We know the medication is in. But with asthma treatment, we are reliant on the inhalation and the correct inhalation for that medication. So those two are really the two big misconceptions that I think is important. The next thing is, the last thing is that it's not only treating the asthma when I have got symptoms with the one that works quickly. That medication that works in the background that are really, really important is not the one that make me feel that now my airways are open. And I can understand that in your mind, it makes sense that the one that opens my airways because it's closed, that's the one that is important. But it's actually the other one. And we will talk about that in a minute. That is the important one. So how do I feel is not that important as how do I treat that. I must be cognizant of how I feel and do I have symptoms, but the one that is actually working in the background, that's the important one. And it's not going to make my lungs weak if I use it all the time, because that also sometimes happens. People think that I will become dependent on my inhaler. I don't think I'm going to become dependent on my insulin if I'm a diabetic. I'm treating the chronic inflammation, so it's actually making my lung stronger, not weaker. Okay, so that is what I mentioned. The reliever medication is when I'm tight in my chest and I feel I cannot breathe, it relieves that feeling of tightness. So that's the reliever. So it makes me feel better. But in the name of controller, that's your important treatment for the chronic inflammation. So your controller treatment is the one that over time is going to make my asthma controlled, the inflammation disappear, and make my lung stronger, so that I don't get tight and I do not need my reliever. So if I need my reliever, I must use my reliever. But we mustn't just depend on that. And if I need to use my reliever, opening my chest more than twice a week, I'm not controlled. Then I'm either not compliant using my controller treatment every single day, or I need more because the disease is now getting worse and my controller doesn't work anymore. Well, the other difficult thing for asthmatic patients to understand is that there are different triggers. So this time of the year, it's the flu season and people get the common cold. There are 300 different rhinoviruses, and that is one of the most important reasons for an exacerbation, triggering an acute asthma attack. Now I feel tight and I need to use my reliever medication. So sometimes I need to step up my controller treatment during the winter time, or if I'm allergic to grass pollen or season, I need more controller treatment because I'm needing my reliever more than twice a week. And then once the season has changed, I'm better again. So I can step down on my controller treatment, not stopping it, but step down. Kind of like we're teaching the diabetic patients nowadays to do carb counting on what is on my plate, and I will only inject as much insulin as I need for this meal. This time of the year, this season, I will use controller treatment so that I need less reliever medication. And then there's a new, very important concept that I need to explain. Until about 3 years ago, we said to our patients, it's okay, you use your controller treatment, and then when you need to use your reliever, you just use your reliever. But now we know that using only the reliever can really give us a false sense of security in the first place. And the second thing is, if I have a bad exacerbation, I keep on using my reliever treatment, it doesn't work anymore. And then I'm really in trouble. So every single time I use my reliever pump, opening the airways, I have to use my controller treatment as well. Even if I had used it this morning and I'm going to use it this evening, if I need my reliever during the day, I have to use extra controller because there was a reason why I needed the reliever. It actually makes sense, but we don't explain always very nicely to our patients, so they do not understand. Cipla really is doing a lot for community education on asthma. Because of these concepts that I've also explained, the misconceptions, the difficulty in understanding on how to use your asthma inhalers and when to use what, they actually came with a wonderful initiative, and they call that bronchi boosters. It's like a cartoon, and it is so informative. So you can really go onto their website, Cipla's website, or just Google bronchi boosters, and you will find all these information on what is asthma, what is a controller and a reliever treatment. And also they've got wonderful videos that actually show you exactly how to use asthma reliever, a MDI, a pump, and then you've got a powder device, and then sometimes we will also add a spacer device for the little ones because they can't really coordinate using their asthma inhalers, and we don't want to rely on nebulizers. So all that will be there. There are got magazines and games for the children to play just to make them comfortable of what asthma is. So that is a wonderful initiative. And then one, saving our planet, because we have to be cognizant of our carbon footprint. And unfortunately, all our asthma inhalers are in plastic devices. And they came with a wonderful initiative that we can actually recycle that, because we can't just throw that in the normal recycle bin because it's a medical device. So the authorities don't allow that. So they came with a recycle campaign, and you can also Google that and see where there are containers at which pharmacies and hospitals throughout the country. And once your asthma inhaler is empty, you can actually, that canister and the plastic device both goes in there, and then they can recycle that, and we are looking after our planet as well. So those are two really important initiatives that Cipla came, and I think it's just wonderful. let me say this, that vaping is not safe. That's also a misconception. If you're smoking or you're vaping, it is not safe. And I know it became fashionable, especially younger people, but in general public, to vape. So that is an irritant. So we are talking about triggers for asthma, winter virus infections, wind. Live in Georgia, and we had a wonderful warm day yesterday, but it was the Berg wind, and that is a real trigger for asthma exacerbation, thunderstorms, but also pollution and irritants. And vaping is an irritant for your lung. So besides the fact that it's going to affect your lung function over time, just as cigarette smoking is going to cause emphysema over time, which is irreversible lung disease, if you've got asthma and you're vaping, it's going to make your asthma more difficult to control. And over time, it's going to become more and more difficult to control. And that is going to make your lung weak, if we're then talking about that. And the scary thing is that if we do not treat asthma well, that chronic inflammation in young people and children that are still growing, their lung function actually never reach the capacity it would have if they did not smoke. Okay. And if we control the asthma well, so if you start vaping at a young age and you've got asthma, your asthma is not going to be well controlled, and that inflammation of the asthma is going to impair lung growth and lung capacity. And then you are putting an irritant in your lung that can actually damage that. So you will have two things that is an onslaught on your lung function. And you must remember that you have to breathe till the day that you die. And you really do want to do that with healthy lungs.